Okay, excellent.
Hi, Dr. Westman. Thank you so much for joining us today. We appreciate it.
Absolutely. Thank you for having me.
Great. So now we want to talk about the rheumatic disease report card. So how are the states ranked in the report card?
The Rheumatic Disease Report Card is the first of its kind report issued by the American College of Rheumatology, looking to see how the states do at helping patients with rheumatic diseases live a better quality of life. So we looked at each state in three categories. First, we looked at access to health care. Second, we looked at affordability of rheumatic disease health care. And finally, we looked at activity and lifestyle factors that help people with rheumatic diseases live a better quality of life.
So what were some things that contributed to Minnesota's ranking?
Overall, Minnesota scored a B, which was a relatively good grade. And primarily, Minnesota is doing well in the number of its residents who stay physically active. So Minnesota residents are staying active and moving, which is great, and that probably has a lot to do with why Minnesota residents reported a low rate of arthritis limitations. However, Minnesota does have an opportunity to improve in the affordability category, which can be established by legislation that would limit the use of specialty tiers, which are practices by insurance companies that increase patients' out-of-pocket costs. Additionally, Minnesota can take steps to require more transparency from pharmacy benefit managers who are used by the insurance companies to distribute medications and end up actually driving up some of the patient's costs.
Now, you mentioned medical costs. What are some of the medical costs that are associated with rheumatic disease?
So this was one of the reasons we did this report card. Medical costs with rheumatic diseases are a real problem for many people. What we looked at specifically were some of the factors that drive up the out-of-patient costs for people. And these related to specialty tiers. So most insurance companies put medications in different tiers based on their costs, such as tier 1, tier 2, and tier 3. But many of the arthritis treatments are put in what are called specialty tiers, where patients are required to pay a % of the cost of the medication rather than a fixed copay amount. Since these medications are so expensive, that can amount to thousands of dollars per month for these patients to pay just to get the required treatment.
And now finally, why is it so important to raise awareness about rheumatic disease?
Rheumatic diseases are so common. Approximately 1 in 4 adult Americans live with a rheumatic disease. Additionally, these diseases affect people at all stages of life, from childhood to young adulthood to the elderly. So it's very important that we as a country help these people live a life as best they can living with a rheumatic disease.
Excellent, Dr. Westman. Thank you so much for your time today. We appreciate it.
Thank you very much, and thank you for having me.